This is the HCA training module on physiotherapy in stroke recovery and how every contact counts. A stroke will have different effects on a person depending on the area of the brain that it's affected. Each area of the brain correlates to a different bodily function, so problems that may occur might affect somebody's speech, their cognition, so the way that they think, the way they understand and see things. It could affect them in a physical way, so they may show as weakness and an inability to move. 3/4 of stroke patients will experience a physical impairment following stroke, and this presentation will only concentrate on the physical impairments and how we can support these patients whilst they're in hospital. Hopefully by the end of the session you will understand a 24-hour approach to stroke recovery, be able to briefly explain about neuroplasticity, be able to position a patient well for safer eating and drinking, identify good or poor seating posture, handle a stroke arm with care during all care activities, and also assist the patient to sit and stand and to assist with walking. So what physical symptoms may cause impairments? We can have changes in power or strength. You might see this as a weakness down one side of a patient. Sensation, so how a patient might feel the difference between hot and cold, or pain, or the sensation of touch. A coordination, so an inability to move in a coordinated fashion to allow you to pick up a cup, for example. Proprioception is an ability of our body's awareness of where it is in space, or where a body part is in relation to another body part. All of these together allow us to move and to be balanced. Physiotherapy aims to improve these using a variety of modalities, such as good communication with the patient, education, sensory input, and the experience of movement. Neuroplasticity is the ability of the brain to form new connections and pathways and change how its circuits are wired. We use this all the time when we're learning a new skill or refining a skill. However, our patients may need now to start to rediscover skills. They might have to work on learning where they are in space, as well as learning how to stand and walk and many other things. Neuroplasticity changes in the brain is happening 24 hours a day, so it's important that everybody is aware and that everybody knows how to play their role in stroke recovery, because for neuroplasticity to occur, the patient needs to be practicing all the time, or as often as they possibly can. Rest is also needed for stroke recovery, so careful positioning can have many benefits, such as preventing joint and muscle strains, helping a patient to feel safe and secure, orientating the body to its environment so the patient again feels safe and secure. Good positioning relieves unwanted pressure, so we can help to prevent pressure damage. It can impact on swallowing and breathing, and it enhances patients' comfort. Here's an example of poor positioning in the bed. What we see here is the patient has slid down the bed, which often happens, and the patient's neck is bent, which makes it very difficult to drink successfully, so they're far more at risk of aspiration or the fluid going down the wrong way. We've got an arm that's tucked under the patient here, possibly not aware of, but that could be causing pressure. And then we have this right leg, the affected leg is weak, so it's flopping out to the side, putting a lot of extra strain on this hip and foot. Here we've adjusted the patient's position, so she's in a much better upright posture, easily able to reach for her drink with her good hand, in a better position so the fluid is far more likely to go down where it's needed. You can see that the arm is supported here on a pillow, so the weight of this arm is no longer dragging on this shoulder. A towel or blanket is rolled up here to prevent this leg now from rolling out to the side. A much better, more comfortable position. the patient is less at risk of gaining chest infections if she's going to be eating and drinking in this position, and also it's giving her a good awareness of where her body is in space, and it's all in a good alignment. Here we have a patient that's asleep on her side. What you can see here is the affected arm is pulled backwards, so it's putting a lot of strain on the shoulder, and if this arm is particularly heavy, then it's pulling it right back. The hand is quite tight and in a fist shape. This top leg here is pulling down, so putting an awful lot of pressure on the hip area, and the body is twisted. So there's lots of areas of pressure, and the patient is likely to feel very uncomfortable. So what we can do instead, the therapist is coming and carefully lifting the arm and supporting the arm. So the pillows are now taking the weight of that arm, which is now brought more forwards. It's also now in the patient's eye line, so she has an awareness of where her arm is in space. The pillow is now being placed between the knees to take the pressure off the hip, that top hip. And a rolled up towel or blanket at the back will prevent the patient from rolling backwards. This also gives an extra feeling of security for the patient too. Ensure the pillow is supporting the head, and you can also see here that her spine is now nicely in a line now, it's not twisted any longer. And the hand is also outstretched rather than in a tight fist. Why might we sit patients out of bed? Many reasons. It helps to orientate the person in space. So if you've not got very good feedback from your body as to where you are, that might be because the sensation is poor, then it can be a very frightening thing. So staying in bed is not going to help that patient to learn to experience movement. So sitting out in bed might be the first experience that they have of this. So we need to make sure that we are sitting them out correctly. It can also help to activate muscles, and it's the anti-gravity muscles that we're looking for, because those are the ones that keep us up against gravity, which are important for standing and for sitting. It improves social interaction. It's much easier to have conversations face to face than it is lying down in bed, and you can also have a look and see what's going on around you, so it's much better for interaction. If we get a good sitting position, it will assist with breathing, eating and drinking. If you're squashed up in bed, quite often your diaphragm is pushed with your stomach, so it's quite often difficult to get a nice deep breath. And also from that point of view, eating and drinking is much better if you can be sat upright. When sitting the patients out, though, we do need to consider what support is needed for them. So is that the seat is an appropriate seat. Some need less and others will need far more, and we'll have a look at those options in a moment. How long do we need the patient to sit out for? When a person's had a stroke, everything is so much harder for them, so they're going to be expending an awful lot more energy just to do the simple things, so they are going to get tired and may well need shorter periods of time sitting out, interspersed with lying down in bed. The other thing to consider rather when sitting patients out is obviously pressure relief. If their skin is very fragile, then it might be discussions with nursing staff to come up with a plan of perhaps how long they need to sit out, or again perhaps the cushion and pressure relieving qualities of whatever it is that we're sitting them out in. Here's an example of poor sitting. So we might have found this patient, coming to give her a drink, but we can see that actually she looks like she's almost falling sideways out of the chair, and this might be because she's tired and weak. She's holding on with her good arm here to keep her from falling, and you see there that actually it's difficult for her to let go in order to go and get her drink. Her stroke arm here is hanging very heavily down by her side, so she may well be getting pain in that shoulder, and she seems to be unaware that that is the case. You can also see here again that this right leg, her stroke leg, is wanting to fall out to the side, obviously with some weakness. So how can we improve this? You can see here that with good seating and positioning, we've freed the patient's arm so that she can readily access her drink and anything else that she might need. We have supported the heavy arm on pillows so that it's far less at risk of damaging. It's also in her eye line, so she can keep an eye on that arm, because that's important that she doesn't neglect that. You can see here we've brought the floor up to her so she has a platform for her feet to sit on. It's important that when you're sitting, that your feet are in contact with the ground. It doesn't have to be the ground, but a foot plate, something that's solid, to give your brain again an idea of where you are, orientate you into space. She's also sitting on a pressure cushion here, which will aid patient comfort. There may be times where the standard seat is not enough, so there are specialist seats that the therapists can provide. Here you can see we've got some supports in at the trunk, which again is giving great feedback to keep the patient in the middle. Her arms are both supported because there's some good arm supports here. Feet are on a platform. Stroke leg is no longer falling out to the side because she's got good support. It's a good supportive chair. And again, posture wise, she's in a line in the middle, and can freely use her good arm to reach and take a drink and do what she needs to do sitting in that position. These chairs often tip back and they will tilt in space, so the patient can be reclined. So if they do become a little bit uncomfortable or want to change position, it can easily be tilted back, which will change the pressure contact points for the patient as well. Correct, careful handling is vital to prevent injuries to the shoulder, especially in a stroke patient. Allow the body to experience normal movement, and also to allow the patient to do what they can safely. If you're going to move the patient, you'll need to consider what their observations are, seek guidance from your clinical member of staff if you're concerned. Consider what drips and other attachments that they may have, such as catheters, IV stands, etc. Patient compliance, so is the patient cooperative? Are they happy to proceed with the input that you're wanting to give them? And obviously if you're going from A to B, then make sure that your environment is clear. So this is an example of poor moving and handling. So this patient is about to be got to sit on the edge of the bed, possibly to be taken to the toilet. The therapist comes straight in and is very brusque with the arm, grabs the arm from the hand. No consideration to talking to the patient, and it's a very quick manoeuvre. The patient wasn't encouraged to partake in any of that at all. Again, this stroke arm will be heavy, and that wasn't attended to at all. So how can we do that involving the patient a little more? So the therapist comes along, interacting with the patient to explain what they want to do, what the procedure will be. There's an encouragement for the patient to find and locate their arm and to take care of that, so they have a role. A second therapist has come in so that we can actually do the manoeuvre in a safe, guided way. The patient was more involved in that manoeuvre. Using the bed to bring the floor to the patient's feet. Of course, the bed can be lifted to a higher point as well if that helps the patient to stand. The equipment is now being brought into place. Therapists all the time talking to the patient to explain what's going on. The second therapist is now taking the weight of that heavy limb and will look after that throughout the procedure and manoeuvre. The patient is being encouraged and guided on how to correctly perform a stand. Note the second therapist constantly in contact with the arm to prevent it falling and potentially causing damage. So for mobilisation, we often look for early standing, which we know may need 3 or 4 therapists to help the patient achieve this. We're doing it in order to stimulate the anti-gravity muscles, which we've already mentioned in sitting, but they're equally as important for standing as a precursor to walking. Standing also helps to orientate the patient to their environment and the space around them, but also gives an extra awareness of how one body part interplays with another. Standing is great to aid bowel health. It improves well-being, and it can be a great challenge for balance. Walking, we find, is often the patient's primary goal. That's what they really, really want to achieve. So when we're looking at that, we also need to consider what kind of walking aids might be useful for that patient. What number of staffing might we need in order to mobilise that person safely? And it might be that we look at putting splints and other kind of supports in place which will help them to be able to achieve this goal. Here we have an example of kind of poor handling while trying to mobilise a patient. So the therapists have come in and almost hauled the patient up out of their chair. The patient seems a little unsure and unsafe, and that right leg is dragging, as you can see. And we've got very much under the arms as a support, and this right leg was dragging. Little communication going on. So how can we improve this? Again, communication is key, so talk to the patient, tell them what you're wanting them to do, helping to facilitate here rather than coming underneath their arms, offering hand support, and here the therapist's hand is just giving a bit of a guidance round the trunk, which will give a bit more confidence. You can also see as the patient is stepping that the right leg is able to step better, and we've also got a splint on the foot here. The stroke shoulder is really vulnerable to injury due to the weakness of the muscles and ligaments supporting it. So that's why it's really crucial that we take extra care. The weight of the limb itself, when it hasn't got any muscular activity happening, increases the risk of injury. Poor sensation or neglect, so when a patient is not getting the sensation from that arm, and so they're unaware of where it is, can increase the risk of injury and causes the arm to be left in really poor positions. Arms which are tight and stiff are just as much at risk of injury as those that are really low tone and floppy. Therapists may provide or advise stretches to aid recovery and comfort, and they may also provide splints used to give a bit of a prolonged stretch and improve the overall posture of the limb. What can you do to help take care of this arm? Make sure that you support the whole arm when moving the patient. Don't pick it up just by the hand. Use pillows to support the weight of the arm, either when they're in bed or in a chair. Encourage the patient to use the arm where possible, and make sure that you draw the patient's attention to the arm if they do seem to be neglectful or ignoring where it is, even as you walk past them on a round doing coffees or something, just ask the patient to locate their arm, bring it back up onto their lap for them. Perhaps put it onto the pillow. Use washing as an opportunity for sensory attention to the arm, and use the splints if they're recommended. For specifics on splints, I would advise speaking to your therapist. So here we have a patient who looks like she's possibly neglecting her right arm, doesn't seem to be aware that it's dropped through the arm of the chair. The therapist notices this, but picks up the arm by the hand alone, which will be putting extra pressure on that heavy shoulder joint here. So supporting on a pillow is the right thing to do, but consider how you're handling it. So how can we improve what we're doing, and how can we encourage recovery in this arm that's being neglected by the patient? The therapist has drawn the patient's attention to the arm to find the arm themselves. They're supporting from the elbow, so taking the whole weight of the arm to place the pillow in. So massage cream is being applied as a form of sensory bombardment, and encouraging the patient to do this themselves is allowing great feedback to the brain that this arm is here and present. Also, obviously, drawing the patient's attention to this arm. So encouraging the patient as much as possible to be involved. The therapist ensuring that she makes specific attention to the insides of each finger. And then to dry, gently rub, again giving some more sensory stimulation. This is a very similar technique that can be used whilst washing and dressing the patient, encouraging the patient to be as active in this as they possibly can. Hospital towels are particularly nice for sensory bombardment. And then if you're going to help a patient to dress, always dress the stroke or the affected arm first. The patient is encouraged again to help. Feed the hand into the sleeve and push the sleeve up as close to the elbow as you can, and then guide it up to the shoulder. And the arm is being supported on the pillow or by the therapist at all times to avoid the shoulder being excessively pulled. At this point, be mindful also of using the affected arm to take blood pressures, because there's again a risk of picking up from the arm, from the hand, rather instead of supporting the weight of the arm. This is now an example of a resting splint that might be provided for patients. It velcros into place. There are many types that may be used, so again, check with your therapist if you're unsure. But if putting splints on or off, just always make sure you do a scan for areas of pressure, whether straps are digging in or causing any soreness. We are constantly changing our positions for our own comfort, and stroke patients often need assistance to do this. or they will use what they have in order to change their position, which often means that they move themselves into an uncomfortable position. So every movement or position is an opportunity for rehab or to influence the neuroplasticity changes that are occurring in the brain. Stroke recovery needs a 24-hour approach for the best outcome for the patient, and if you can understand how you can influence this and make every contact count, then we can improve the recovery for our patients. The take-home message from this is definitely around the stroke shoulder. It's really vulnerable, so please take extra care when handling it. Thank you.